According to the Maryland Department of Health, almost 60,000 people in Howard County are now fully vaccinated against COVID-19. I would like to thank our health department for quickly and efficiently and safely getting shots in as many arms as supply allows. We know that many people are still eager to get vaccinated, and we're looking forward to continuing our work with the governor and MEMA to stand up a mass vaccination site in Howard County by the end of April. While the focus has shifted to vaccination, the virus is still very much with us. To date, Howard County has had more than 17,000 cases of COVID-19 and sadly lost 232 of our residents. Our latest 7-day average positivity rate is 4.5%, and our 7-day average case rate per 100,000 of our population is 16. And while we are one of the most efficient jurisdictions in the state at administering vaccines, we all must remember that most of us are still not yet protected. We need to continue to wear our masks, practice physical distancing, avoid large gatherings, and follow the recommendations from the CDC. Even with the warmer weather and more activities shifting to outdoors, we need to be wary of the many variants that are more transmissible, which is why testing is still a key factor in fighting this pandemic. Testing that is accessible, reliable, and widely available helps us prevent outbreaks and slow the spread of this virus. More routine and surveillance testing can be especially helpful to stopping the spread from people who are asymptomatic and ensuring more accurate data about our positivity rates. Since last July, Howard County has conducted more than 30,000 tests per month. In December, we conducted nearly 65,000 tests. However, since December, our testing number has dropped to half of that, with only approximately 30,000 tests administered thus far in March. Testing is vital to stopping the spread of this virus and keeping people safe. And rapid and easy access testing is critical to getting us back to normal. Just as we've added mobile vaccination clinics in recent weeks, it's important to have mobile testing in our community. Last week, on our bi-weekly call with the White House, officials emphasized the need to improve testing accessibility, equity, and speed, especially as students and educators head back to the classrooms. I'm proud that here in Howard County, we're already ahead of the curve. Today, we're launching mobile community-based testing here in Howard County. And we plan to be at the following locations from 3 p.m. to 7 p.m. each week. Mondays right here in the Long Reach Village Center. Tuesdays at North Laurel Community Center. Thursdays at Recreation and Park Headquarters. Fridays at the Elkridge 50 Plus Center. And starting April 7th, Wednesdays at Normandy Shopping Center. These mobile sites will be more accessible to our community, provide quick test results, and improve our ability to contain COVID-19 and get back to our lives more fully. Residents without cars can easily walk, bike, or take the bus to these locations, and the later hours will provide more people to get testing during the work week. Our incredible partners at First Call Urgent Care are offering 15-minute rapid tests and 24-hour PCR results. And as more students and educators head back to school buildings, it's vital that we encourage more routine testing to potentially isolate COVID-19 cases and potential outbreaks. I want to thank the Howard County Educators Association for working with us to identify these locations that will help remove barriers to testing in our community and ensure our students and educators have this important access. Thank you again to First Call Urgent Care and Air Bus Service for their partnership and support in making this effort possible. Since the start of this pandemic, we've looked for creative solutions to tough and ever-evolving problems. And just as importantly, we've worked to ensure that our residents have equal access to the tools needed to beat this pandemic, including testing and vaccines. This mobile community-based testing is another step in the right direction to put this virus behind us, and I encourage our community to utilize and share the word about this new and exciting initiative. As I've said since the beginning, we're only going to beat COVID-19 by working together. Thank you.
Thank you, County Executive. And now we'll hear from Dr. Maura Rossman, Howard County's Health Officer.
Good afternoon. Thank you, Angela, and thank you, Dr. Ball. As the county executive mentioned, there are over 17,000 cases of COVID-19 in Howard County to date. And those are the ones that are recorded or reported because of testing, like the van behind me will soon be doing. With increasing allotment of vaccine, there are unfortunately still hundreds of people each day, each week, who will become ill with the virus. And I'm sure we have all heard over the past few weeks, and as Dr. Ball mentioned, our positivity rate and case rates have unfortunately trended upward. The severity of COVID illness can range from mild to severe. It is imperative that if anyone becomes even mildly ill with symptoms like a cough, shortness of breath, fatigue, muscle aches, or a new loss of taste or smell, that you be tested. Testing is simple. It's easy. And this van will allow anyone with the illness to take the proper actions so not to spread the virus any further, and to identify anyone with whom there has been close contact so that they too can be tested if needed. Testing and identifying contacts is a key factor. Contact tracing, we've all learned that word 12 months ago, 14 months ago. It's a key factor in helping to reduce the spread of COVID-19, especially critical given the variants that are more easily transmissible. These mobile testing sites will offer no-cost rapid and PCR testing. Rapid testing and PCR testing will allow for a quick preliminary diagnosis so people can quickly isolate themselves and protect others. A final follow-up confirmation of the diagnosis will come very shortly with the results of the PCR tests. Today's announcement of the mobile testing sites at convenient locations within our community throughout the county will make access to testing even easier and more convenient than ever before. As the county executive mentioned, our testing numbers have fallen off, but the disease has not. This allows us to increase our testing for those that need it. These sites are strategically placed in areas to ensure that all members of our community have access to no-cost testing. Even as we move into more vaccine, it's still important to continue practicing the non-pharmaceutical interventions that we all know. Wear your mask, physically distance, wash your hand, and still limit large gatherings. We're soon there. Stay safe, be well, and get tested if needed. Thank you.
Thank you, Dr. Rossman. It's a pleasure to introduce Dr. Geller, Medical Director of First Call Urgent Care.
Hello. I'd just like to reiterate what Dr. Ball and Dr. Rossman said, the importance of getting tested even if you've been vaccinated if you develop symptoms. We've noticed that people who get vaccinated still can get disease, unfortunately, and also if you've been exposed and have any symptoms, it's better to get tested early so that we can prevent you from spreading the disease to other people. Also, the importance of accessibility is important. That's why we've set up this van to allow people to come and get access without having to drive if you can't drive or if you're unable to drive. So we have locations both in drive-through centers at the Howard County Fairgrounds and our Meriwether Post, Pavilion in our urgent care and Maple Lawn, and also this bus at the locations you just heard about. So all we'd like to do is encourage people to come in and get tested as quickly as possible so we can help stamp out this disease. Thank you.
Thank you, Dr. Geller. And now we'll hear from Howard County's Education Association's president, Colleen Morris.
Good afternoon. The Howard County Education Association is so excited to be involved in this program. COVID testing is important to curb community transmission, and we know that if our community transmission is low, our school buildings will remain open, and our educators, students, and families can stay as safe and as healthy as possible. This mobile lab will allow access for many community members that right now might be unable to get to the testing sites that we have already in place. We are very grateful to Dr. Ball's team for creating this mobile testing lab and for the coordinated efforts of the HCPSS Executive Director of Program Innovation and Student Wellbeing, Dr. Caroline Walker, who worked with us to identify the areas of greatest need in our community. We hope that both our educators and community members will take advantage of this testing opportunity in order to keep our school buildings open safely. The quote, "An ounce of prevention is worth a pound of cure," is applicable here. Until we have beaten this virus, we need to use every preventive strategy possible. Thank you again, Dr. Ball and your team, for helping to make this mitigation strategy accessible for everyone. Thank you.
Thank you. And now we'll hear from Brad Ayer, Business Manager of Airbus Tour and Travel.
Good afternoon. This is an exciting announcement for Howard County. On behalf of Airbus Service, I want to say how honored we are to participate in this service for the community. The past 12 months have been incredibly challenging for the motor coach and tourism industry. The majority of our fleet has been parked since March of last year. We are honored to have an opportunity to partner with First Call to finally put our equipment to use in a way that helps the community manage this health crisis. We would like to thank Matt Russell, Shaska Thomas, the First Call team, and our talented technicians at our garage. We've never converted a passenger motor coach to a traveling medical lab before, and it took a team of folks working together to design and implement a product that would work for this application. We hope this service can benefit the Howard County community and others in the near future. Thank you.
Thank you, Brad. And now that concludes the final remarks, but we'll open it up to the press for questions. You have a question?
With the cases rising, not just here locally, but nationwide and statewide, the CDC director warned of, impending doom following with the weather warming up and everything. Is there any statement that we can give for that, what people should know?
With the rise in cases that is happening locally and nationally, what is the comment that Howard County has? Dr. Rossman? Oh, okay. Sorry.
The increase in the positivity and the case rates concerning, not just in Howard County, but the state of Maryland and nationwide. I think we can attribute that to a couple of things. Certainly the variants that we've talked about today. We can also, I think that we've all become a little relaxed, feeling really hopeful and maybe a little too hopeful that we can engage in activities that maybe aren't, or I should say we're not doing the mitigation strategies. Wearing masks really helps. I'll say it again, wearing your mask really helps, but when you're eating together with a group of people and you don't have your mask on, your mask's not helping. I know a lot of people personally that are beginning to travel. We've all wanted to meet our grandchildren, our children, celebrate the things we haven't, maybe a little too soon. So I'm optimistic, but I'm also cautious, saying please, please wait a few more weeks. Let's vaccinate some more Howard County residents so we can really have a great summer.
Any other questions from the press? Okay, thank you. That concludes our press conference on mobile testing. Thank you.
PCR is sent back and we'll have that usually within 12 hours. We say within 24 hours, but it's, in most cases, same day.
I like that.
Yeah.
Promise reality,
Yeah.
deliver dreams.
Oh yeah. It's, what we're actually doing in some cases, people get results back in 6 hours, which
Wow.
is just kind of crazy. But if you say 8 hours, then at 8 hours and 1 minute, we're all
Yes.
calling in. So
Usually 7 hours and 50 minutes.
yeah, exactly. Yeah, yeah. So yep, we got a SIG, Iowa.